Mrs. Allred.
Hi Trisha, how are you today?
Fine. I've got a new patient here. Actually, she's a former patient. She's new for me. Her name's Mrs. Greenwood, and she's here for a prophy, but she hasn't been here in the past 3 years.
Oh, okay, I see. Has she been seeing her own dentist the last 3 years?
No, she's been doing quite a bit of traveling since her husband retired, so she knows she's overdue. She did have a tooth extracted recently because of a root fracture, but she didn't have a prophy at that time. She said she likes coming here because she feels like we do a better job on her teeth, and we'll tell her if there's a problem and she needs to see her dentist.
Okay, I see. Well, what problems would you foresee with that?
Well, I think it's great that she likes to get her teeth cleaned here, although I might encourage her to come more often. And she really ought to see her dentist for routine checkups.
Yeah, I agree. It's a good thing. It's good to get a checkup at least once a year with her regular dentist. Looks like she's taking some Fosamax. Can you tell me a little more about that?
Well, she's been taking Fosamax for about 5 years now.
Okay. And how might that influence your treatment?
I'm not quite sure.
Okay. Has she complained of any discomfort in her mouth when you confirmed her appointment or right now during her medical history review?
Well, she did say that the area where she had her tooth extracted was still painful.
Okay. Would you recommend some x-rays for her?
Yes, because her last full mouth was 5 years ago, and that was before she started taking Fosamax. So it looks like we have just done really a set of bite wings since then. The full mouth would have been before she started taking bisphosphonates, so if we take another full mouth, we can compare the two to determine if there's been any significant changes.
So it looks like we did a full mouth series 5 years ago and then one set of bite wings since then. So I think that's a great idea. Very good critical thinking. And definitely if there's been some changes, we can compare them. So now if there have been some changes, what would be your next step?
I think we may have to tell her that she should see her dentist for further treatment.
Yeah, unfortunately that's true. The rest of her medical history looks good, so why don't you go ahead and do her oral exam, enter an oral extra exam, her perio assessment, and take the x-rays, and then we'll go from there. We still may be able to see her if her films and her perio charting are okay, but make sure you get a copy of those x-rays for Mrs. Greenwood to take with her.
All right. Well, we can see visible bone loss on your x-rays, and when I check the pockets around your gums, I notice deep pockets around your upper left and lower left molars. I'm afraid we're not going to be able to treat you in our clinic.
What do you mean you can't treat me? I just want my teeth cleaned.
Well, you're taking Fosamax, and while that's helpful for your osteoporosis, it can actually affect the bones of your jaw.
Well, I don't understand how my medications have anything to do with my teeth. I just want to get my teeth cleaned and get out of here. I've been coming here for 13 years. There's never been a problem before. Why don't you want to clean my teeth today? Do you have someone else scheduled or something?
No, I don't have anyone scheduled. We just aren't allowed to see you if you're taking Fosamax and there's bone loss in your mouth.
Well, I still don't understand how my medicine has anything to do with getting my teeth cleaned. Maybe I should see another student who wants to clean my teeth.
Why don't I get my instructor to come and talk to you?
Why don't you do that,
Okay,
please?
okay.
Hi, Mrs. Greenwood.
Mrs. Greenwood, this is my instructor, Mrs. Allred. Mrs.
Hi.
Allred, this is Mrs.
Hi.
Greenwood.
Nice to meet you.
Nice to meet you, too.
I understand you're a little upset today.
Yes, I'm very upset. I've been coming here for 13 years, and now she's telling me that I can't get my teeth cleaned because I'm on Fosamax, and I really don't see how that has anything to do with cleaning my teeth.
Well, believe it or not, the medications that you take do affect your oral health, and Fosamax helps keep the bone from eroding, but it changes the bone so it can't heal as well when it's injured. So, in other words, it does help to strengthen the bone in your body, but it doesn't actually make new bone. If you've had an injury or surgery in your mouth, which you've had a tooth taken out recently, I understand, it puts you at risk for death of the jawbone. And when you don't have your teeth routinely cleaned and you don't floss daily, then it also puts you at a greater risk for gum disease and bone loss.
But that's why I'm here. I want to have my teeth cleaned today.
Well, I understand that, but you haven't been to see us in the past 3 years, and you've developed some deep pockets around your teeth.
Why would my doctor put me on something that could make my jawbone die? I would think the doctor would know more about that than the dentist would anyway.
Well, actually, Mrs. Greenwood, the hygienist and the dentist have much more experience and knowledge about this because we actually see it firsthand. I have your x-rays here, if you'd like to take a look at them.
Why don't we just walk into radiology and we can get a better view of the films?
Okay.
Okay. Okay, see, Mrs. Greenwood, these are your x-rays from 5 years ago. And you can see the bone levels here. See all this white? That's bone. Now, these are the x-rays we took today. And you can see the difference. See where it's dark? It looks like there's nothing there.
Yeah.
Well, that's where you've gotten some bone loss. So that's why we can't really see you in our clinic. It's too much for us to deal with.
Oh my gosh, is my jaw gonna fall off?
No. Your jaw's not going to fall off, but you really shouldn't be seen in the student clinic because the students are still learning. And the skill level of the professional hygienist will be better suited for your situation. Plus, you want to establish regular visits with your dentist so he can monitor your mouth closely.
Well, what if I just stop taking the Fosamax?
Well, you definitely don't want to do that. The Fosamax stays in your system for years anyway, and your physician put you on the Fosamax for a reason. So it's never a good idea to go off prescribed medication without first talking to your physician. And plus, you'd be putting yourself at greater risk for broken bones if you go off the Fosamax.
I understand. I'm not happy, but I'm glad you're looking out for me.
I'm really sorry that I would have loved to have cleaned your teeth today, Mrs. Greenwood, but I don't want to put you at any risk.
And if you'd like, Trisha can do some oral hygiene education with you so that that way you can reduce your risk for further bone loss.
Okay, I'd appreciate that.
Okay, let's go.